The recovery period after your anterior cervical spine surgery or neck surgery is very important. Here are some key guidelines and explanations Dr. Ravi wants you to know to help make your spine surgery a success. After surgery, you can expect to stay home 1 to 2 days in the hospital following your surgery. When you are ready to go home, Dr. Ravi will give you a follow-up appointment. How will I feel after surgery? After surgery, you may feel pain around the site of the surgery and may even have arm pain with numbness and tingling. This is normal and may take several weeks to resolve. The reason you may have pain is because of the surgery itself and from swelling of the previously compressed spinal nerves. Most of the healing occurs in the first few months after surgery. This is why your recovery period is so important. Pain control after surgery. We will give you pain medication following your surgery. We encourage you to use Tylenol as your first line of pain control and reserve narcotic pain medications for only the difficult times. Narcotic pain medications are addictive. They also cause constipation and tell your brain it's okay not to breathe. Alcoholic beverages, for this reason, are also forbidden while on narcotics. Stool softeners are a great idea. With time, your pain should improve, and so we wean you off these medications within 2 to 4 weeks after surgery. 1 year after surgery, you can also start to use an NSAID medications such as Advil, Aleve, Celebrex, Motrin, or ibuprofen to help supplement your pain control. Care for your incision and showering. A gauze dressing will be over the incision. You must change this every day for 5 days to a new clean dressing. To prevent infection, keep this incision clean and dry and free of any ointments or creams. You can shower 3 days after surgery, but avoid soaking the incision and pat. Don't rub the incision dry. This also means no baths, hot tubs, or pools for 6 weeks after surgery. If at any time the incision is red, swollen, or has drainage that looks like pus, then you may have an infection. If this happens, or if you have a fever greater than 101.5, then call our office. Activity. Walking. It is very important to get out of bed and walk. Too much time in bed can cause pneumonia or blood clots in your legs. Try not to sit around for longer than 20 minutes. Start out slow, walking 1 to 2 blocks during the first week and gradually increase your distance and frequency. Stairs with a handrail are okay too. Wear the neck brace you were given. It helps to support your head and helps keep your bone graft from moving while it heals. Try not to fight the collar, rather work with it. Driving. You cannot drive until you are no longer wearing your collar. You can be driven for short distances only. Lifting. Do not lift anything heavier than 5 pounds for the first 2 weeks after surgery, and no more than 10 pounds for the 3rd and 4th week. Disability. The usual recovery period after cervical spine surgery is 8 to 12 weeks with a complete healing in 3 to 6 months. Dr. Ravi will tell you when you can return to work. That will depend on the type of work that you do and how your recovery is going. Dr. Ravi's office can provide your job with any documentation that you may need. Last few things to remember. If you have persistent pain with urination or are unable to urinate after surgery, please call our office. Smoking is forbidden in the recovery period. It gives you an increased risk of complications and poor bone and nerve healing, so please do not smoke. Remember to eat a well-balanced and nutritious diet. This will help with healing and also with constipation caused by the pain medication. Dr. Ravi and his team are here to help you in every step along the way and wish you a speedy recovery.